Millions of people who get health insurance through the Affordable Care Marketplace might have to redo their budgets when some tax credits expire at the end of the year. Here in Florida, we have more people enrolled in the ACA Marketplace than any other state. That, by the way, is according to Health and Human Services. So our senior reporter, Emily Young, spoke with people here in Southwest Florida to see how they're planning to adjust. She joins us now from Lee Health on Del Prado. Good morning, Emily.
Good morning, Shari. Good morning to you at home. Yeah, we're outside Cape Coral Hospital in Del Prado where things could start to look a lot more expensive. The Office of Insurance Regulation just announced earlier this month insurance premiums are set to hike about 23 to 40%. Now, here in Florida, we have about 4.7 million people who get their health care from the Affordable Care Act marketplace, and that is more so than any other state. That's like 1 in every 5 people that's about to take a huge hit financially. But first, let's backtrack so I can explain a little about these tax credits. So these were enhanced premium tax credit. They were federal subsidies that lowered the monthly cost of insurance that was bought through healthcare.gov. They were calculated based on your income and your household size. So for example, if you have a plan that costs $700, but based on your income and household, you're only supposed to pay $200, that means the credits cover the rest of that cost, so that $500 in that case. But that all changes after December 31st when these credits just expire. Sue Gottesman from Northport, I linked up with her a couple of days ago, and she told me her husband is retired. She works occasionally as a substitute teacher, so they're mostly living off of their savings. One of her sons is on her insurance plan, but thanks to the tax credits, it's a bill she's actually never sees. But now her family cannot afford this impending price hike. She's planning for her son to get insurance through his job and for her to find a cheaper insurance, but she knows it'll likely come with more out-of-pocket costs. So she says she's questioning whether or not to even have health insurance.
You know, you want to have some kind of insurance, but if it's taking away, we have to have hurricane insurance. We have to have homeowners insurance. We have to have a minimal amount of car insurance.
To you, those are the necessities.
Well, you have to. I mean, you have to. I mean, I suppose you could not, but that would be devastating. But you know, but so of the insurances, I mean, health insurance is probably the one you'd want to give up, especially if you're healthy.
Again, so if you're on one of these plans, you have until December 31st to adjust, and I'm going to have more about this in the later show, so make sure you stick around on Fox 4. In Cape Coral, Emily Young, Fox 4.